Welcome to today's Lunch and Learn. My name is Sharon Waldern. I have been a nurse for 42 years and I have done a wide range of activities, but I worked in public health and then I have worked here at Good Shepherd Hospital. I am currently retired. Today's topic is on protecting our health, and it's a very timely topic with COVID this year, and as well as the fact that we're coming into flu season. So let's get started and we'll show some slides. Whenever you're ready. Okay, today's topic, as I said, is protecting our health. And we're going to talk about how we can help ourselves stay healthy this flu season. What we're going to talk about is using the skills that we already have to stay healthy. Most of us know this stuff. This is just a good yearly refresher. So what are the skills that we can use? Daily exercise, walking, stretching. All of these are good to help build our body's stamina. Mild to moderate regular exercise every day really helps strengthen our bones, our muscles, and our health in general. Eating healthy foods. Here's some examples of what to aim for. 5 to 7 servings of vegetables, fruits, lean meats, whole grains. We all know about, we do need some oils as well. The important part about eating a nutritional diet is that it helps our body to work efficiently. Staying hydrated, drinking water as much as possible, and drinking other beverages in moderation only. Water is really important for our body to function at its peak efficiency. It really makes all of our systems work well together. And then washing our hands with soap and water before and after almost any activity. Preparing food, providing personal care to ourselves or someone else, touching an animal. There's hundreds of times when we should be washing our hands. And you'll probably get tired of hearing people talking about washing your hands, but it is the best way to prevent infection. Staying home when we don't feel well, and that means if you wake up in the morning and you're achy, you have a headache, you've got a sniffle, stay home until you have figured out whether this is just a mild case of something that disappears or if you need to go and follow up with your physician. Avoiding large crowds. We've been doing this for months now, limiting our physical contact with others, wearing masks over our mouths and noses when we're out in public. And wearing a clean mask each day is important as well. People are starting to come down with infections around their mouth and chin, and it's usually because they're wearing the same mask over and over and over again, which also isn't particularly healthy because you've already contaminated that mask. Covering our mouth and nose when we cough, sneeze, and when we're blowing our nose. Discarding all used tissues promptly in a garbage can, not dropping them on the floor of the car, not just kind of shoving them to the corner of the desk, but getting rid of them in a garbage can. Cleaning and disinfecting frequently touched surfaces in our homes, in our vehicles, in our workplaces, and you've probably noticed if you've been out in the grocery stores that most of them now have hand wipes for you to use on the cart handles so that you're protecting yourself as well. And then getting the flu shot every year, as well as other recommended immunizations. So here's a diagram on washing your hands. You get your hands wet first. You use a good, at least a teaspoon or more of soap. And then you lather and scrub your hands for 20 full seconds. And that means between your fingers, the palms and the backs of your hands, your wrist that's connected to your hands as well for a full 20 seconds. And then you want to rinse for a full 10 seconds. Turn off the tap and dry your hands thoroughly. 20 seconds you can either count for 20 seconds, you can use a timer, you can sing happy birthday twice through. If you've got small children in your house, you can sing row, row, row your boat twice through. Any of those things are 20 seconds long, and that way you know you've washed your hands for long enough. So here's some Photographs. Notice the woman with the mask. That mask is covering her nose, her mouth, her chin, and there are no gaps in the mask. This is the correct way to wear any mask. The little one in the middle is using the crook of her elbow to cough into, and the person on the extreme right has gotten their flu shot. So, why do we get a flu shot and when do we get a flu shot? We need to have a flu shot every single year. The vaccine changes yearly because each year there tends to be a different predominant strain that's infecting people, and so that's what they aim for with the vaccine each year. You only need one flu shot each year. Occasionally, a young child may need two, but most of the time, all of us only need one. And the flu vaccine can be given anytime after August. That's usually when the New Year dose comes out. However, in the Pacific Northwest, the experts recommend that we get our shots somewhere between October and November. And the key reason for that is that our peak flu season tends to be between January and March. Now, having said that, as you all know, last year we had quite a hit in December, so it's going on the law of averages. There is also a high-dose flu vaccine for anyone over 65 years of age. This year it is a quadrivalent, which means it has 4 strains in it, and that's the first time that's happened. The high-dose flu vaccine has been out for several years, but this is the first year that we are protected against all 4 strains like everyone else is. Many people may feel a mild fever, muscle aches, and a headache a few days after they've received their flu shot. They have not caught the flu. This is the body reacting and forming antibodies and having a robust response to the flu vaccine. It is to be expected. It's not unusual. And you can take Tylenol, aspirin, whatever you feel is necessary to relieve the discomfort you're feeling. It takes 2 weeks after receiving the flu shot for you to be protected by the vaccine antibodies. Up to that time, you're not fully protected. And the biggest thing to remember, and I know there's a lot of people that still believe that a flu shot can give you the flu. It really cannot give you the flu. It is an inactivated vaccine, which means it doesn't have a live virus in it, so it cannot make you sick. If you catch the flu within a week or two of getting the shot, it means you were exposed before you had enough antibodies to protect you. So, where can you get a flu shot? This year, Good Shepherd is having a drive-through flu immunization clinic on Saturday, October 24th, and it'll be from 8 a.m. to 2 p.m., and it will be in the parking lot that is between the pharmacy and the Good Shepherd Medical Group. Will be done on a first-come, first-served basis. At this point, our pharmacist says we have a good supply of flu vaccine. And if you want more information, please call the Good Shepherd Education Department at 541-667-3509. So I did mention other immunizations, so I want to go into that just a little bit. Other adult immunizations that are recommended are the pneumonia vaccines, and there's 2 different types. The Prevnar vaccine is a single shot, and it's only given once, and that usually is given after the age of 50. And then the pneumococcal vaccine, some people can receive it before the age of 65 if they have at high risk for respiratory issues, have a history of asthma, some kind of immunosuppression, and then they should get another shot once after they turn 65. The pneumonia shot is not meant to be given every 5 years. It is once you've had the 2 shots, you're good for life. The next set of shots are the zoster vaccines or the shingle shot. There are two vaccines for that as well. The Zostavax, which is the original shingles vaccine, is a single shot that people can receive after 50 years of age. And then the Shingrix vaccine is the newer vaccine, and it's a series of two shots spaced 2 to 6 months apart. And again, that can also be given after 50 years of age. And actually, the CDC recommends that anyone after the age of 65 should be given the Shingrix series as opposed to the Zostavax shot. But it may depend on what pharmacy you go to. So you'll need to check with your doctor on that and check with the pharmacy you usually go to. Another shot that everyone should be getting every 10 years is the Tdap shot. That's the one that has the tetanus, diphtheria, and pertussis. The old tetanus shot did not have the pertussis in it, and it's now been included because what we're finding is older people don't get really sick with pertussis, but they can actually get pertussis looks like a bad cold in most older adults, but they can pass it on to infants who are not fully immunized with some pretty tragic results. We have had 2 infant deaths in the last 20 years in Umatilla County due to a baby contracting pertussis from an adult that didn't know that they had it. And again, hepatitis A and hepatitis B are also recommended for adults. It's not standard, and again, you can talk to your doctor and see whether they recommend that you get it. Public Health and the CDC highly recommend that if you're traveling anywhere, especially to a third world country, that you definitely get covered for both hepatitis A and hepatitis B. Hepatitis A is the foodborne one. You can get hepatitis A from eating food or drinking water that has been contaminated by somebody who's ill with hepatitis A. And oftentimes with hepatitis A, you're most contagious before you really start showing symptoms. You just don't feel good, but you don't feel really ill. And that is when you're the most contagious. So those are when we really recommend either one of those. And they're a series of 2 to 3 shots based on the vaccine that you choose to get. There is a vaccine called Twinrix, which has both hepatitis A and B in it. So if you've never had either one, that's a really good option. Fewer pokes and the same immunization. And then there's also the HPV vaccine and meningococcal and a few others that are recommended for preteens to young adults. If anyone wants more information, one of the best places to go is the CDC website. The other place you can go is you can call the public health office and ask questions on that. They can actually mail you out materials as well. And for those of you who have questions about travel vaccines, the closest place to get travel vaccines in Umatilla County is the public health department up in Kennewick. They have a travel clinic up there, and that is the closest one in this area. So I'm open for questions. If anyone has any questions about any of the information that I have given you, I'd be happy to answer those. All right. Well, thank you very much for attending today's Lunch and Learn.